Nigerian resident doctors are holding another indefinite strike barely 3 months after staging the first one despite the COVID-19 pandemic. According to the doctors, the latest protest is due to the government's failure to respect their demand for better working conditions. But the government say over 50% of their demands are met and they will further engage the doctors on the matter for ultimate breakthrough. Here's more details of that in this report.
It's the second time in less than 3 months that the resident doctors, as they are called, will be embarking on an indefinite strike action despite the coronavirus pandemic. But unlike the first time when doctors at COVID-19 centers were exempt from the strike, the entire 16,000 population of the resident doctors are taking part in this latest industrial action, which is aimed at compelling the government to meet their demands for better welfare.
They have failed to procure a genuine life insurance, group life insurance for doctors and all health workers that have been fighting this pandemic. As we speak now, we have lost 14 of our members and none of them has been able to get any claim from any life insurance company. That is one of the demands too. Government has failed to pay us the COVID inducement allowance they agreed to pay us from April, May, June, July, August, September. And in that agreement, it also stated that by September, they will review the hazard allowance, which is the sponsored sum of 5,000 naira to a better, reasonable amount. Then the state hospitals, tertiary health institutions have failed to implement the Residency Training Act of 2017, which is a law of the federal government of Nigeria.
But the country's Minister of Labour and Employment in a statement accused the doctors of being economical with the truth, insisting that more than half of their demands have already been met. He's now called a meeting with the leadership of the doctors to iron out the areas of differences.
If they can offer us something that will be tangible, we definitely want to go back to work. We want to go back to work, so we're not putting a timeline or anything on when we want to call off this strike. So I know that our members will not want to hear anything until they see tangible outcome.
While Nigeria's COVID-19 toll has been on the decline in the past few weeks, the strike action is likely to cripple an already overstressed healthcare sector, as more healthcare workers' unions are now threatening to join the industrial action.
You know, this issue of payments and strikes is becoming a problem in this country. You know, people should be paid their dues because they have families. They have to feed their families. They have their own things they want to do. But the oath they took while leaving the medical school also says they should, no matter how difficult it is, they should take care of lives. If they abandon those patients in the hospitals and they die, they've not been able to meet their moral obligations.
Attention is now focused on that meeting between the government and the doctors. If both sides fail to reach some kind of agreement, it could derail the country's fight against the COVID-19 pandemic.
Nigerian resident doctors are, of course, holding a second strike barely 3 months as government failed to respect their demands.